Assalamualaikum and a very good day to all, especially our lecturer Dr. Fatmawati. My name is Muhammad Syafiq Firdaus bin Nazaruddin. I'm going to be presenting a topic about post-traumatic stress disorder among bullied victims in school. We from group number 7, section 1. Okay, first of all, I'm going to cover the introduction part. The first point is the practice of traditional approaches in organizational counseling for PTSD for bullied victims in school is the introduction of group therapy. It is kind of a psychotherapy in which one or more therapists deal with a group of individuals at the same time is known as group therapy. Second is the practice of modern approaches in organizational counseling for PTSD is cognitive behavior therapy, or as known as CBT. CBT is a kind of psychotherapy that has been repeatedly shown to be the most effective treatment for PTSD in the both short and long term. CBT for PTSD is trauma focused, which means it focuses on the trauma events at hand. Third point is post-traumatic stress disorder is a mental health condition that is brought on by witnessing or experiencing a terrific event. The fourth point is theme that is related with PTSD is psychological disorder and therapy. So there are three basic principles of treating PTSD. First is trustworthiness and transparency. Second is safety, and third is peer support and mutual self-help. The fifth point is the importance of addressing PTSD for bullied victims in school is to avoid victims from being emotional discomfort, physical abuse, and eventually destroy one's self-confidence. The reason why we need to study for PTSD for bullied victims in school is it may be used to assess the effect of trauma on children or to assist victims guide therapy efforts. Second point is it may help determine if a more complete examination is required by identifying pupils or victims who have been suffered trauma at school. Third point is it may be used to prevent and treat victims or students before it results in worse condition and eventually will be self-abuse. That's all from me. I will pass to the next presenter. Thank you.
Hello everyone, my name is Won Lewy and number ID is AA20067. So before I start, I want to ask you all, do you know what bullying is? So bullying is an unwelcome aggressive behavior among school-age children that involves an actual or perceived power imbalance. So over time, this behavior repeats or it's likely to repeat. So children who are bullied can have a serious and lasting problems. And this problem, I call it post-traumatic stress disorder. And also we can call it PTSD. So after some of my research, I can say with absolute certainty that bullying does indeed cause PTSD symptoms in today's children. So in order to be considered bullying, the behaviors must be aggressive and include both power imbalance and repetitions. So what is an imbalance of power and repetitions? So the meaning of an imbalance of powers means that kids who bully use their power, such as a physical strength, access of embarrassing information or popularity, to control or harm others. So power imbalance can change over time and in different situations, even if they involve the same people. So the meaning of the repetitions is bullying behaviors happen more than once or have the potential to happen more than once again. So which means repeat the same action to bully the same people. So bullying also included the actions such as making threats, spreading rumors, attacking someone physically or verbally, and excluding someone from a group on purpose. These behaviors can affect who have been bullied to feel stress, and over time, they will easily develop a post-traumatic stress disorder. Bullying also can affect everyone, those who are bullied, those who bully, and those who witness the bullying. Bullying is linked to many negative outcomes including impact on mental health, substance use, and society. It is important to talk to kids to determine whether bullying or something else is a concern. So bullying also affects everyone who experience negative physical, anxiety and depression, social, emotional, sleeping problems, academic, and mental health problems. This fear of the effect also can make who are bullied become a post-traumatic stress disorder. So at here, I would like to choose one example of these issues. So I would like to choose anxiety and depression. So why? Why anxiety and depression can cause a PTSD? So this is because it will make you increase feeling of stress and loneliness. And this will also change in sleep and eating pattern. So here, sleeping problem will also occur. And if you feel depressions, you will feel no appetite to eat. And your health will get worse over time and also will lose of interest in activity they used to enjoy. So this all of the issue is coming out of the PTSD. Bullying is a complex social dynamic that can best be understood by using various theoretical frameworks. So here, I choose a 4 types of theory was used in social capital theory, dominance theory, the theory of humiliations, and organization culture theory. So why I choose these 4 theoretical frameworks? These theoretical frameworks is better understand the motivation behind bullying behaviors, bullying's negative effect on victims, and how school culture and climate play a role in a prevalence of bullying. Specifically, the acquisition and maintenance of a social capital and the desire for dominance are prime motivating vectors for the initiation and continuations of bullying perpetrations. The lack of a social capital experienced by victims serves to maintain victims in their current role and prevent them from gaining social status. So furthermore, the domination used by bullies so to subjugate victims result in intense humiliations that has lasting negative effect on victims, such as anger and depression. So the overall culture and climate of the school setting impact the prevalence and severity of bullying behaviors, highlighting the need of whole school bullying interventions. So I think that's all from me, and then I would like to pass to the next presenter to continue the presentations. Thank you.
Okay, hi, my name is Daniel Haikal bin Ahmad Faizal, matric number AA20129. I'm going to present about the impact of PTSD towards individuals, society, and organizations. Firstly, in individual aspect, traumatic event can have a major impact on interpersonal relationship. A traumatic experience can become embedded in the memory structure of the individuals, causing a progressive avoidance of interpersonal triggers. This traumatic experience could also provide detrimental effects on self-awareness and communication, which are important to maintain healthy relationships. As for children, they may lose interest in play, become socially withdrawn, and have an extreme temper. Next, PTSD can also strongly influence a person's health, such as diabetes, heart problems, and sleep disturbance. For example, sleep disturbance which can compound several other physical and mental symptoms. Sleep problems are likely related to the nightmares that sufferers experience and high incidence of hyperarousal, which reduce sleep quality. Secondly, in society aspect, a white society may struggle to comprehend exactly what PTSD is and how it affects the individuals or their family. As a result, words like nutcase, unbalanced, or disturbed become placeholder for people. Simple social force like language can inadvertently push people with PTSD away from community involvement and the supports that they need to get well. Next, PTSD is one of the most strongly associated with suicidal behavior. The reason the individuals attempt suicide or have suicidal thought may be PTSD itself or may be that existing psychiatric conditions such as depression and anxiety. The other main reason may be public acceptance. The society may decries and boycott those individuals with PTSD because of some illogical stigma. Lastly, in organization aspect, generally symptoms of PTSD can interfere with working performance and teamwork in numerous ways. This includes memory problems, lack of concentration, poor relationship with co-workers, trouble staying awake, fear, anxiety, panic attack, emotional outbursts while at work, flashback, and absenteeism. Usually, they will feel that they are unable to work and take a decision to quit. Thank you.
Hi and Assalamualaikum everyone. My name is Wan Siti Fairuz binti Wan Muhammad Azmi and my ID number is MA19038. So I am going to continue the previous discussion of my teammates about this matter of issues, which is post-traumatic stress disorder or PTSD. So let's begin. Post-traumatic stress disorder or PTSD is a disorder that develops in some people who have experienced a shocking, scary or dangerous event. Anyone can develop PTSD at any age. It is important to remember that not everyone who lives through a dangerous event will develop PTSD. In fact, most people will not develop the disorder. Theoretical and practical solution of this disorder can help you to regain a sense of control over your life. The primary treatment is psychotherapy, but can also include medication. Combining these treatments can help improve your symptoms by, the first one is teaching you skills to address your symptoms. The second one is helping you think better about yourself, others, and also the world. The third one is learning ways to cope if any symptom arise again, and treating other problems often related to traumatic experience such as depression, anxiety, or misuse of alcohol or drugs. Some of the ways that we can use to help people with PTSD is called as psychotherapy. Some type of psychotherapy used in PTSD treatment include the first one is eye movement desensitization and also reprocessing, which is called as EMDR. EMDR combines exposure therapy with a series of guided eye movement that helps you process traumatic memories and change how you react to them. There is also ways to help people with PTSD is called as cognitive behavioral therapy, which is called as CBT. CBT is a therapy that helps to focus on assisting the person in changing destructive thoughts and behaviors. It is a type of psychotherapy that helps a client to quickly identify and manage problems. The approach is goal-oriented and often involves homework. The homework helps to reinforce the in-person seasons. The goal is to change the person's behavior by changing the routine. Another ways that we can use to help people with PTSD is called interpersonal psychotherapy. Other approaches, in particular involving social supports, may also be important. An open trial of interpersonal psychotherapy reported high rates of remissions from PTSD symptoms without using exposure. As for the medications, the most studied type of medication for treating PTSD are called antidepressant, which may help to control PTSD symptoms such as sadness, worry, anger, and feeling numb inside. The second one is benzodiazepines. Benzodiazepines are not recommended for the treatment of PTSD due to the lack of evidence of benefits and risks of worsening PTSD symptoms. The third one is prazosin. Prazosin is an alpha-1 androgenic antagonist, has been used in veterans with PTSD to reduce nightmares. Study shows a variability in the symptoms improvement. The fourth one is glucocorticoids. Glucocorticoids may be useful for short-term therapy to protect against neurodegeneration caused by the extended stress response. Last but not least, cannabinoids. Cannabinoids come from cannabis. Cannabis is not recommended as a treatment for PTSD because scientific evidence does not currently exist. The cannabinoid nebuline is sometimes used for nightmares in PTSD. I think that's all from me. Thank you.